d'Ottawa Centre. As you can see on your screen, this virtual meeting is being recorded and it will be shared with the candidates and all of those and those of you who have signed on to this session. My name is Yves Leduc. I am a member of the Board of Directors of the Council on Aging of Ottawa, and it is my privilege and honor to serve as your host facilitator for this 7th information session with the candidates from the main federal parties for the Riding of Ottawa Centre. So not only I want to extend a warm welcome to all of the registered participants who have taken the time this morning to attend this all candidates meeting, but I'm also quite delighted by the response from the candidate. It is the first of the series of 8 meetings, that's the 7th today, where we have the five candidates from the 5 main federal political parties in attendance. So I'm quite ecstatic about that. In attendance today, we have Yasir Naqvi from the Liberal Party, Carol Clemenhagen from the Conservative Party, Angella MacEwen from the NDP, Angela Keller-Herzog from the Green Party, and Regina Watteel from the People's Party of Canada. I want to say that these sessions are organized in collaboration between the Council on Aging of Ottawa, the National Association of Federal Retirees, and the Ottawa chapter of the Canadian Association of Retired Persons, the 3 of us sharing similar concerns related to older adults and seniors, as well as issues dealing with long-term care in particular. L'objectif de cette rencontre est d'offrir une tribune aux candidats pour discuter des enjeux affectant les aînés. The goal is to provide an opportunity to the candidates to address key senior issues that have significant impact on our members, stressing in particular the need for a coordinated national senior strategy, as well as the urgent need to provide an enhanced care and financing for long-term care. Now, I would like to introduce our collaborators and give them the opportunity to speak briefly about their organization, starting with Rick Baker, who will bring greetings as president of the Ottawa chapter of the Canadian Association of Retired Persons. Rick, the floor is yours.
Thank you, Yves. Bonjour. Good morning to the candidates and members who have joined us today. As Yves said, my name is Rick Baker, and I serve as the president of CARP Ottawa, which is one of some 25 chapters across Canada, serving over 350,000 members. We are the largest seniors advocacy association in Canada, and it's our goal that all seniors and retirees have a good quality of life in their later years. We offer numerous benefits and programs, and in Ottawa over the last year and a half, some 50 virtual webinars on many different topics that our members have identified as important to them. We hope to be back together in person within the next couple months to celebrate the end of this awful pandemic and enjoy the collegiality at our workshops and exhibits we provide to all seniors. Our board of directors has been working diligently over the last year on key advocacy projects such as long-term care and fall prevention. We are very pleased to collaborate with the Council on Aging and the National Association of Federal Retirees on these all-candidate meetings to hear prospective politicians respond to our key themes we have chosen. I wish all the candidates the best of luck in their campaigns. Merci.
Merci, Rick. Maintenant, je cède la parole à Monsieur Robert Giroux, President of the Ottawa branch of the National Association of Federal Retirees, who will bring greetings from his organization. Robert, vous avez la parole.
Merci beaucoup, Yves. Tout d'abord, je suis Robert Giroux, comme on l'a dit, je suis président de la section d'Ottawa de l'Association nationale des retraités fédéraux et je vous transmets les salutations de notre conseil d'administration et de nos nombreux bénévoles qui travaillent à des événements comme celui-ci. We are also delighted to be working together with the Ottawa chapter of CARP and the Council of Aging. Our national association was established 58 years ago, and today we represent more than 170,000 active and retired members of the federal public service, the Canadian Armed Forces, the RCMP, and retired federally appointed judges, as well as their partners and survivors. Ici, dans la section d'Ottawa, nous avons 33 800 membres et in Ottawa Centre, we have 3,540 members. We are an advocacy organization, and like CARP and the Council on Aging, we share a vision of for the future where all Canadians experience a safe, secure, and healthy retirement. We put special focus on protecting the pensions and benefits of federal retirees. We make sure that every government is aware as they are looking for cutbacks on savings. Our association will vigorously protect the pensions and benefits that federal retirees have earned. Our branch also focuses on education and information sharing, particularly related to financial literacy and healthy aging. To keep our members and volunteers safe, we offer weekly webinars over Zoom. We invite everyone to learn more about our activities by visiting our website, NAFROttawa.com. On suggère aux membres, s'ils veulent avoir plus d'informations sur nos activités, de visiter notre site web, NAFROttawa.com. Our association has 4 priority issues: retirement income security for all Canadians, a national senior strategy for all Canadians, universal public pharmacare, and much improved support, care, and benefits for veterans. For today's events, and we appreciate your participation, candidates, you were asked to focus specifically on a national senior strategy and the dire need for long-term care standards and reform, and equally, the dire need for adequately fund home care. The pandemic has exposed the terrible issues that residents face in long-term care, and its effects are not over yet. According to the Ontario government's website, over 41% of the COVID-19 cases that resulted in death between January 15, 2020 and September 2, 2021 were residents of long-term care home. We lost 4,000 seniors who are important members of our families and our communities. These are unprecedented times, and we need an unprecedented response. That is why today we will all be listening closely to what candidates have to say. We want to hear how your party, if elected, will respond to this unprecedented situation. Merci beaucoup. Thank you very much.
Merci beaucoup, Robert. C'est bientôt le tour des candidats à prendre la parole. We're getting closer to the candidates taking the floor, but before that, I would like to just share a few technical reminders. All candidates have been provided, initially it was 5 minutes, but we have extended their time to 7 minutes for today's meeting so that they can present their position and party's platform on older adults or seniors issues. There will be a reminder that the time is about to expire 1 minute before it ends. As I think everybody is aware of, we will not be having a question and answer period following the candidate's presentation, but we invite all the participants who want to communicate directly with the candidates to do so, and their contact information are being provided. So we hope everybody will enjoy the session. But before I introduce the candidates, it's now my turn to say a few words about the Council on Aging. Le Conseil sur le vieillissement d'Ottawa est un organisme bilingue à but non lucratif, voué à l'amélioration de la qualité de vie de tous les aînés. Ici, on parle à travers tous les stades du vieillissement, essentiellement de la cinquantaine jusqu'en fin de vie. The Council on Aging is a bilingual, volunteer-based charitable organization dedicated to improving the quality of life of older adults living in Ottawa. We strive to promote and champion the basic tenets of an inclusive, caring city and the importance of community-wide engagement with a special focus on vulnerable and isolated older adults. Concerns and issues of older adults are identified and solutions are sought through forums, research projects, and partnership network. So this session is a very good example of the coordinated efforts by our three organizations. J'aimerais également partager avec vous mon expérience personnelle avec les centres de soins de longue durée. I would also like to share my personal experience with long-term care home. Unfortunately, over the past 6 years, I have lost my two parents. Both of them had transitioned from their house directly to a long-term care home where they have unfortunately passed. So my mother has left us 6 years ago, well before the pandemic, and my dad was unfortunately taken by COVID back in April of 2020, so at the beginning of the first wave. So I'm reading this because this has allowed me to witness the lack of resources in long-term care homes well before the pandemic. The pandemic has dramatically taken the life of many older adults, and it has worsened the challenges that healthcare workers have been facing for too long, such as lack of personnel, lack of training, lack of resources, lack of financial resources. I'd like to take this opportunity to also thank healthcare workers for their tremendous efforts throughout the pandemic. The public in general was shocked by the situation, again, a situation that existed well before the pandemic. If I have a wish there is a wish I would like to express, and it's, let's hope that those lost lives are not in vain. Older adults and seniors don't have time for finger pointing. So let's become proactive in addressing older adults' concerns, starting with long-term care, where there is definitely an urgent need to provide enhanced care through a major reinvestment. The list, however, does not stop here when we are looking at older adults and seniors issues. Think about housing, not just from an aging perspective, but also from a climate change perspective. How many of the senior homes are not properly equipped with air conditioning? Think about income security, social inclusion, transportation, just to name a few. So all of these needs to be acted upon, and to properly address them, we need leadership to come up with a solid and coordinated national seniors strategy. So on behalf of our three organizations, I am therefore looking forward to what the candidates have to offer in response to these challenges. Moreover, beyond your party's platform on aging, I am interested to hear from the candidates what you would do to help move these issues forward if you are elected on September 20th. So it's time for the candidates to present to the participants today. We will start with the Liberal Party candidate, Mr. Yasir Naqvi. Yasir, you have the floor. You are muted.
There you go. Thank you. I was trying to get the host to unmute me. Thank you very much, and good morning, everyone. Je m'appelle Yasir Naqvi. Je suis le candidat pour Parti libéral à Ottawa Centre. My name is Yasir Naqvi. I'm the Liberal candidate in Ottawa Centre. I'm joining you today from my home in the community, which is situated on the unsurrendered and unceded territory of the Algonquin and the Anishinaabe peoples. I want to thank all of you for organizing this really important conversation I see few faces that are familiar to me. And so I'm happy to see that you're engaged and you're involved. And I have to say, I miss seeing all of you in our community in person and can't wait for the day that we'll be able to get together in person and share ideas like we used to. This has been a very different and difficult time for all of us to live through. Many of you may recall I used to be a member of provincial parliament in Ottawa Centre for almost 11 years until 2018. As therefore, I've got the experience and credibility of delivering on behalf of the community, and we were able to work on a lot of important issues to advance our community, to make it more caring, to make it more compassionate, to make it more inclusive for everyone. This is, as mentioned earlier, is a very important and pivotal time for Canada, and one of the key reasons that I felt compelled to run for public office again, to put forward my name to become a member of parliament for Ottawa Centre, is because we have to make some really important decisions moving forward as we rebuild after this pandemic. We know that there's going to be a new normal. Things the way they were until March 2020 are not going to be how things will be as we get out of this pandemic. And the decisions that we make today are decisions, in my view, going to impact us for at least next decades. And that's why I think experience, knowledge of our community is that much more important. There were three things that really has motivated me to seek your vote. If I can just quickly highlight that and then move on to some specific topics that you have highlighted that are very important. In terms of my motivation and something that I'm hearing from the community on a regular basis as I'm knocking on doors is, one, we have to engage in inclusive rebuilding of our economy as we move forward post-pandemic. For that, we need to make sure that everybody is part of this rebuilding. And in one particular policy that I think is really important is to introduce a national childcare program. This is our opportunity to make sure that we've got affordable, quality, bilingual childcare for our families, especially women who have been and continues to be the primary individuals responsible to raise children. In order for us to ensure that women can fully participate in the workforce and be the driving force behind rebuilding the economy, having a $10 a day childcare program is going to be not only a good social policy, but a critical economic policy. And the Liberal Party of Canada has put forward a realistic plan with 8 provinces and territories already signatories to it. I want to make sure that provinces like Ontario also become part of that. Second is to have an aggressive fight against climate change. We know that threat is real. We need to ensure that we are fighting climate change and bringing our greenhouse gas emissions down. But not only that, but also use climate change as a anchor piece to the new industrial policy, whereas solutions, clean tech solutions are being developed and Canada is leading the world. And the last thing that's something personal to me and I feel quite compelled around is racial injustice. We still have people who are marginalized. Racism still exists in our society towards Indigenous people, Blacks, and people of color. I have significant experience working on these issues when I was your member of provincial parliament, and I want to bring that work forward at the federal level as well. So I just wanted to share with you some of my thoughts on and the reasons that I felt so compelled to be part of this race and why I'm seeking your support and your vote on September 20th. Moving to issues around seniors, I would categorize the Liberal Party of Canada's a plan for seniors in 3 categories. You're starting to see a theme here. I'm talking in threes right now. Number one, and I think that is critical, and I'm sure all my colleagues who are seeking election in Ottawa Centre will agree with me on that, is that we have to effectively fight this pandemic. We have to put an end to this pandemic. We have lost too many lives. Our lives have been turned upside down, and unless and until we move beyond this pandemic, we will not get through. Second is around income supports. We need to make sure that seniors have appropriate income. We decrease the eligibility time frame for seniors from age 67 to 65. We want to move forward with a plan to boost the OAS by 10% next year for seniors 75 and older, and increase the GIS by $500 for single seniors and $750 for couples starting at age 65. Lastly, when it comes to long-term care, one of the things we want to do is work collaboratively with provinces and territories to create a legislation that would outline standard of care for long-term care homes. We need to make sure that we have got a floor, so to speak, across the country, national standard of care across the country that all provinces and territories comply by. We want to lead that process. Not to mention, I see my time has come to an end very quickly. Not to mention, we want to train 50,000 more personal support workers and pay them at least $25 an hour as minimum wage for the important work they do. Thank you very much.
Thank you, Mr. Naqvi. Obviously, 7 minutes has gone by fairly quick. And thank you for providing us with some of your comments on seniors issues, but also highlighting some of the broader issues that do also have an impact on older adults and seniors. Now I would like to introduce the candidate from the Conservative Party, Ms. Carol Clemenhagen. Ms. Clemenhagen, you have the floor.
Merci beaucoup. Bonjour, il me fait énormément plaisir de participer ce matin à cette réunion et à ce dialogue. Over the course of this campaign, I've been door knocking a lot. I hear frustration about the Liberals' election call, stress about the rising cost of living. Seniors mention healthcare, young families, housing. People want post-COVID economic recovery. I want politics to be about collaboration and accountability. The Conservative Recovery Plan follows that path. That means support for local priorities, like the new civic hospital construction, renovating long-term care facilities, public transit, increasing the housing supply. More than ever, strengthening local healthcare capacity for our growing and aging population is key. I am very proud of the Conservative commitment to unconditional health transfers to the provinces to enable that strengthening. This will increase bed capacity, home care, and access across the continuum. It responds directly to the pleas from the deliverers of healthcare, the provinces, that the liberals have ignored and stonewalled since 2015, even throughout the pandemic. One of the concerns seniors every day face is financial insecurity and worries about their prospective financial security. 1/4 of seniors over 65 are caring for a loved one at home or in long-term care. Seniors are in many ways they've become the unpaid backstop of our health system. Liberals increased OAS for those over 75, but left out the 65 to 75 year age group at a time when cost of living, inflation, is at something like the highest it's been for almost 20 years, and it's taking a bite out of everything. We know that Canada has one of the lowest ratios of long-term care workers to seniors in the OECD. We know that we need more long-term care beds, and we know we need to reduce wait lists. And we know that frailty and dementia in our aging population requires appropriate resources across the continuum of care. The Conservative approach and plan means practical support for a coordinated national senior strategy. For example, helping seniors stay in their homes or to live with their kids, if that's something that works for them, with tax credits and benefits that provide direct financial relief, like a home accessibility tax credit of $10,000 per person, allowing claims for medical expense tax credits from seniors or their caregivers, including their kids, for home care. A new seniors care benefit, $200 per month per household for seniors living with their kids. It means $3 billion of infrastructure funding to renovate long-term care facilities over the next 3 years. It means strengthening national standards for long-term care recognized by provinces in regulatory and accreditation protocols. It means increasing the number of PSWs through priority immigration programs for long-term care and home care workers. And it means doubling Canada's workers' benefit for lower income seniors who choose to work part-time to supplement a retirement income. Canada's investment in basic research must also keep pace at internationally competitive levels, retaining our world-class scientists, expanding knowledge, pushing innovation. That includes research on the journey of aging, wellness, and the unique and positive contributions of older people in all aspects of a healthy society. My career was in healthcare. I was the CEO of the Canadian Hospital Association. Yasir Naqvi had a long provincial political career and says he's ready to leverage that experience federally. Yikes. We're all still paying off the billions in electricity scandals from his provincial experience. Our Conservative recovery plan rebuilds the economy. It responds to our community's needs. Why should voters support me? Collaboration and accountability, the middle ground for practical policy development. I will stand up for Ottawa Centre and for our community's needs. Please contact me directly or our campaign directly. I'd be very pleased to engage further with participants. votecarol.ca has all the information how to get in touch with our campaign. I'm asking for your vote on September 20th to be your member of Parliament. Thank you.
Thank you, Carol. You have provided us a quick overview of the Conservative platform. You've touched on quite a long list of issues, which definitely demonstrate that we would need several days for all of us, the various candidates, to go through all of these issues in depth. Thank you very much. I'd like now to invite Ms. Angella MacEwen from the New Democratic Party. Angela, you have the floor.
Merci beaucoup, Yves. Bonjour à tous. C'est un plaisir d'être avec vous ce matin. Je m'appelle Angella MacEwen. I am the NDP candidate here in Ottawa Centre, and I'm really excited to be with you this morning. As always, I'd like to begin by acknowledging that we are here today on the unceded and unsurrendered territory of the Algonquin and Anishinaabe people. And we are grateful to them and want to say that we are in solidarity with the Anishinaabe Algonquin people and work towards reconciliation in everything that we do. Like many of the people that I've been speaking to every day on the doorsteps in Ottawa Centre, I've grown even more concerned about the state of inequality in our community and across our country throughout the COVID-19 pandemic. The federal government has cut taxes on the very wealthy over the past 20 years, and at the same time, it cut transfers to the provinces. And this has led to an underfunding of the social safety net that we saw in stark contrast for people who were living in long-term care centers and working in long-term care centers during the pandemic. And as Yves said at the beginning, this did not start during the pandemic. It's been there for a long time. My mother was a nurse who worked in long-term care, and I often through high school volunteered because the long-term care center was across from the school in the small town where I grew up, and my great grandmother was there. So I got to spend time with her and lots of the other seniors. And that particular setup was really nice, actually, because lots of kids would come over and spend time with the seniors. And that was a really valuable connection, that intergenerational friendship and spending time together at that community center. So I know what the potential is for long-term care in terms of providing those services to seniors and meeting their needs. And I know what the reality is now. And the reality is that no province had a good plan. No province fully funded long-term care, had enough staff, had the resources required to meet the needs of people, and people suffered, people died because of that underfunding. And it doesn't have to be with it this way. I'm running for the NDP because we're the only party offering the bold solutions that we need to address our country's biggest crisis. It's unprecedented times, and mediocre solutions don't work in unprecedented times. We need unprecedented solutions. We need unprecedented investments. And as more Canadians enter their senior years, we need to be making better choices to be ready to meet their needs and ensure that everyone can live in dignity. With the right leadership, we can make sure that our institutions and public services are strong and have the resources that they need so that every senior has access to the healthcare and social support that they need to make life a little bit easier. So to deliver these results across the country, the NDP will lead a national senior strategy that will work with provinces, territories, and Indigenous governments to make healthcare a priority for seniors healthcare a priority, reduce isolation, and tackle seniors' poverty. So this includes a fully funded national dementia strategy, an elder abuse prevention plan developed with seniors to put an end to abuse and neglect in our communities. We made an announcement yesterday about bringing back a Crown Corporation to replace Greyhound bus service. I know lots of seniors use that to stay in touch with their family, to come to cities to use medical appointments. And it's really the only affordable way for a lot of people to travel. And that has now basically stranded people. And it also, for people who live in or are at risk of domestic abuse or elder abuse, it leaves them without an affordable way to escape that situation. So we think that service is really important, that we should bring it back in an at-cost basis. It doesn't work for profit. There's not enough money there to make a profit on it, but we think that it's sustainable in terms of bringing it back as a Crown Corporation and providing that as a public service. The NDP proposed over the last year a national pharmacare plan in the legislature. The Conservatives and the Liberals teamed up to vote it down. Liberals have been promising it since 1997. The NDP have fully costed it. We know that it will save provinces money, and so that it will be quite straightforward to come to the table with money to pay for it, and that provinces will be eager to sign on and to agree to that plan because it saves them a lot of money in hospital care as well. And it will save seniors hundreds of dollars every year and make sure that no one has to choose between medicine and other essentials. So for the end user, it will just be you go to the drugstore and instead of using your credit card, you use your health card to pay for the medicine that you need. When it comes to accountability for the horrors that happened in long-term care during the pandemic, the NDP is definitely fighting for you. Because of decades of cuts, underfunding, and privatization, COVID-19 claimed the lives of thousands of Canadians, the highest proportion in the OECD. And successive governments have failed to invest in those public services, and many families paid the price for that. So we want to ensure, first of all, that every senior or person with a disability has access to the care that they need to be able to stay in their own home as long as they need to, but that also we bring long-term care into the Canada Health Act and create strong national standards that we enforce, and that the standards are tied to funding. The provinces get the funding if they're enforcing those standards. Ongoing staffing shortages were a problem, so we're also putting money towards training of staff and higher wages and benefits, because it's not just training that's an issue, it's also retention. This is a very difficult, challenging, and important job, and without the wages and benefits there to sustain workers, they can't afford to stay in those jobs. So we think that they need higher benefits, higher wages and better benefits. Lots of workers in long-term care didn't even have paid sick days, which was part of the problem. They couldn't afford to stay home when they got sick. It's time to take profit and greed out of the care of our most vulnerable loved ones. New Democrats know that Canadians need access to quality home care and long-term care no matter where they live. So to that end, we will end private for-profit long-term care and bring long-term care homes under a public umbrella, beginning with the federally owned long-term care company, Rivera. Removing profit from the equation will help ensure that there are more resources able to be devoted to staff and to patients. We also want to work collaboratively with patients, caregivers, provincial and territorial governments to develop the standards for home care and long-term care. And we would legally protect access to home care and long-term care services, ensuring a consistent quality of care across the country. We're also, in terms of inflation that Carol mentioned, inflation is a little bit higher. Obviously, anyone who's older than me will definitely remember the 70s and 80s when inflation was much, much higher than it is now. And we're not at risk of that happening. But inflation for core basics like food, water, shelter are increasing faster than pensions or wages are. It's simply true. So the NDP is looking at making housing more affordable by increasing the supply of public, not-for-profit, and cooperative owned housing. Because I've talked to many.
Sorry to interrupt, Angela.
Yes.
Your time has come to an end.
Oh,
if you could
okay,
just
sorry.
wrap it up, please, I would appreciate
Sure.
it.
Yeah, I've talked to many seniors who are spending most of their incomes on rent and don't have enough money for food and have to go to the food bank. So we think that there's a broad range of affordability issues that we need to help address so that seniors can afford to live. Thank you.
Thank you, Angela. Thank you for this rapid overview of the NDP's platform. A lot of food for thought in your presentation. Thank you very much. Now, I would like to turn to the Green Party, and I will invite Ms. Angela Keller-Herzog to present the Green Party's perspective on seniors issue. Angela?
Okay, sorry, I'm here, but the host is blocking me from starting my video. Can you hear me?
Yes, try again, Angela. You should be able to turn your video on now.
Ah, there we
There you
are.
are.
Thank you very much. Sorry, there's a function blocking participants from doing that. So, okay. So thank you, merci beaucoup for inviting me to talk with you today on the unceded territory of the Algonquin Nation. As of 2020, 1/3 of the Ottawa population and 9.5 million, or 25% of Canadians, are over 60 years of age. It's very important that we address this very large demographic group when we set policies. Merci pour l'opportunité de discuter de ces enjeux très importants. One point I would like to recognize from the outset: not all seniors are vulnerable. Many live independently and want to retain an independent lifestyle for as long as they can. And these seniors want to have easy access to recreation, parks, and social opportunities. Mais certains citoyens ont besoin d'appui pour rester chez eux en sécurité. Ils ont peut-être besoin de transport pour des rendez-vous médicaux ou de l'aide à faire l'épicerie. Valuable community and outreach services provided by community centers such as Abbotsford House and the Good Companion Center must be supported with adequate funding and not get lost in the gaps and the shuffle between federal, provincial, and municipal responsibility. En réponse à vos questions, je suis d'accord. Il n'y a pas qu'une solution au défi du logement si nous voulons soutenir aux aînés aux différents stages de vieillesse. So on home care, the Green Party proposes in the highlights a dedicated seniors care transfer to provinces and territories for specific improvements to home, community, and long-term care, separate from federal health transfers. Secondly, to increase the proportion of long-term care investment in community and home-based care from 13 to 35% to match the OECD average. And lastly, we would change the home renovation tax credit from $10,000 per household to $10,000 per person for more people to age in place. Tax rebates alone are certainly not the answer. Next, let's talk about long-term care principles and standards. We are all very well aware that there are terrible deficiencies, and Canada has the worst record of COVID-19 deaths in long-term care among G7 countries. Long-term care is a provincial responsibility, but the federal government can play a big role in creating national performance standards and making sure the provinces follow them. Our Green Party leader, Annemie Paul, lost her father during COVID, not to COVID, but to negligence in care. The Green Party platform has a great deal of thought and detail regarding a senior strategy, long-term care reform, mental health, including calling for a dementia strategy, and also calling for a national elder abuse and neglect strategy. Back to long-term care. Some highlights. The Green Party proposes aid to bring long-term care under the Canada Health Act to improve the quality of care, including with national standards, to improve the quality of life of workers in long-term care, including training, pay, benefits, and paid sick leave. And lastly, to end for-profit long-term care facilities and reorient long-term care towards community-based model. I think that COVID has run a very unethical experiment comparing the outcome and the results of private versus public long-term care. And although we didn't want this experiment, we should definitely take the lessons. Lastly, I would like to talk about some financial issues that are part of the Green Party's senior strategy. In general, our Canadian healthcare system has long waiting times for many procedures. To correct this, federal funding must be restored to levels prior to Paul Martin's cuts in the mid-1990s, and there should be federally mandated standards on healthcare performance and wait times. On the subject of pensions, to better protect the pensions of all Canadians, a Green government would amend legislation for companies that file for bankruptcy, to change the insolvency legislation to extend super priority to any unfunded pension liabilities. Nos retraités devraient passer avant le bonus aux actionnaires et aux dirigeants de compagnie. We call for regulating the Canadian Pension Plan Investment Board to require divestment of coal, oil, and gas shares and ensure that climate risks and investment are disclosed. Greens believe that a guaranteed annual income should include all seniors. Now, speakers were asked, sorry, I just noticed that my video again is not working, but you can still hear me, right?
Yes, we can.
Okay, sorry, I've tried 3 times to make it come back and it's blocked from the host side. Okay, so speakers were asked to speak on certain issues and I've addressed those. But I should tell you that the reason that I ran as a candidate is because of climate and biodiversity. And I believe that these issues are also important to seniors, not just the raging grannies. Sometimes the climate crisis seems overwhelming and complex. But at base, it's simple. We need to stop putting more greenhouse gases into the atmosphere. The main source is the burning of fossil fuels. And here Canada has a great responsibility, as we have the world's third largest proven reserves. Okay, I've tried my video again. It's still not working, I'm sorry. So Canada has the world's third most large proven reserves of oil. And up to now, the record of Canada is terrible. We have never met a target that we've set. Under the Liberal government that talks a lot about climate, Canadian emissions have gone up year by year since 2015 when they came into power. And the record under the Conservatives and Harper before that was no better. When Canadian emissions are compared to other G7 countries, our record is clearly the worst. And other countries have made efforts and succeeded in reducing their emissions. In the recent French leaders' debate, Justin Trudeau refused to say that there would not be further expansion of the oil and gas extraction in Canada. And the most recent budget featured an astonishing $5.9 billion in new fossil fuel subsidies for the oil and gas sector. So it's the pipeline all over again. So
Angella, the time has come to an end, so I will invite you to wrap up your comments.
okay. So I would say that an essential duty of the social contract between government and citizens is to make seniors live their lives to the fullest, but it's also to ensure that our children and grandchildren have a future on a habitable planet. Thank you.
Thank you very much, Angella, for sharing the views from the Green Party's perspective. You've touched on senior issues, but you've also touched on issues that are affecting not just the senior, but the population in general. So thank you for that. Now, we have our final presentation from the candidate from the People's Party of Canada. And I would like to invite Ms. Regina Watteel to present the views of the PPCs. Regina, the floor is yours.
Hi. First, I'd like to thank you for inviting me to this session and for giving me the opportunity to introduce myself and why I was compelled to run in this election. My name is Regina Watteel, the candidate for the People's Party of Canada. I have a strong background in the sciences, including a PhD in statistics and extensive experience in risk-benefit analysis. I am a married mother of 3. My youngest is in high school, the other 2 in university. I have aging parents. My dad is 81 with congestive heart failure, diabetes, and a bad leg. He can barely walk. My mother is a retired nurse. She keeps a close eye on dad's health. I have 4 siblings. 2 are in healthcare. 1 is a respiratory therapist. The other is a heart technician. The first thing I did in March 2020, when the pandemic was called, was gather the available worldwide data and conduct a risk analysis to assess the threat to my family members, young and old, the risk to my siblings in healthcare, and also to the community at large. I wanted to find a way to mitigate the risk and to protect family and loved ones. The data showed that the elderly and those with underlying health issues, like my dad, were at high risk from COVID, while most others, especially the young and healthy, were not. The risk between these groups varied by orders of magnitude. It was clear that resources should have been put towards hospitals and long-term care homes in order to protect the most vulnerable and their caregivers. While strategic lockdowns and focused measures would have been justified, there was never any evidence supporting general lockdowns, school closures, or many of the measures put in place by the federal or the provincial governments. Let's be clear. There is a 1,000-fold difference in COVID risks for those below 20 compared to those above 80. But the government completely ignored this and chose a blanket response. From a risk analysis perspective, what the government did was a complete and utter failure. It guaranteed a great deal of unnecessary harm to society while maximizing cost. And they're still doing it. What is needed, what was always needed, is a strategic, smart approach. So imagine if all that pandemic money, hundreds of billions of dollars, went into healthcare and long-term care homes instead of shutting down the economy and paying healthy people to stay home. Imagine how much stronger our healthcare system would be. The economy would be in a better state. Our rights and freedoms would be intact. Seniors would have been better served, and their children and grandchildren would not have been forced to suffer with isolation, disruptions to education, increased mental illness, and access deaths. Instead, the Liberal government had no strategy and passed the buck to the provinces, who in turn canceled or delayed millions of needed surgeries and treatments, creating huge backlogs. They moved chronically ill hospital patients out of hospitals and into already crowded and understaffed long-term care homes. Many died alone without proper care. Healthcare workers hired on behalf of concerned family members weren't even allowed in to care for loved ones. Family members were not even allowed to attend funerals. No matter what promises any of these candidates make here in terms of funding, it will not compensate for the damage done by their inefficient, largely non-strategic blanket approach. The People's Party is the only party that openly supports an evidence-based strategy. Instead of funding harmful lockdowns, we must direct COVID funds where needed to strengthening hospitals and long-term care homes to safeguard against this and future outbreaks. While everyday healthcare is provincial jurisdiction, the People's Party understands that Ottawa has an important coordinating role at the national level and can influence provincial policies. We will develop a national pandemic strategy for healthcare and long-term care homes in collaboration with provinces, territories, seniors and associations, and experts in various fields, including healthcare, virology, statistics, and economics. Together, we will explore options and possible solutions. We will employ a risk-benefit strategic approach to maximize health outcomes and reduce costs. This is something that none of the major parties appear to be open to. They insist on politics as usual and appear to have learned very little from this ordeal. Finally, government officials will be held to account for their decisions, investigations, and resignations forthcoming. On a personal note, I just want to say that I found what transpired in long-term care homes extremely upsetting. I've heard many, many heartbreaking stories, some very, very close to me. They did not receive the funding or attention that was needed. As I mentioned in the beginning, I do have extensive expertise in risk, benefit, and options analysis. And I personally, if I was elected, would love to be part of the solution. And I really thank you very much for allowing me to speak here today.
Thank you, Regina. You are definitely bringing a different perspective to this debate. I quite appreciate the fact that you were able to be here with us to share the People's Party of Canada's platform with the participants today.
Thank you.
this essentially brings us to the end of our session. We have heard a varieties of views from different horizons, different perspectives. There are food for thought coming from each of the candidates, from each of the party going into this election on September the 20th. Just one comment I would like to share with the candidates and the participants. I always find it myself personally difficult to reconcile, on one hand, the need for major reinvestment in healthcare on issues that are affecting seniors and older adults, and the cost of moving forward in that direction. And I think that's an issue that has not been touched on that much throughout the election campaign. The concern here is that we need to be careful if, when we start dealing with how we will be dealing with the cost to pay for all these programs, to make sure that it does not negatively impact the seniors who, generally speaking, may be affected if taxes were to increase, and could bring some of them into poverty. So there's a delicate balance that we have to take into account when we're moving forward. Donc, j'aimerais offrir mes plus sincères remerciements à tous les candidats et la meilleure des chances le 20 septembre prochain. I want to express my sincere appreciation to all the candidates for their preparation and their participation in today's event. We particularly appreciate your commitment to the seniors, not only in your ridings, but across Canada, and we wish you all good luck on September the 20th. So the next step is for the participants to exercise your right to vote if you have not already cast your ballot. So the issues that were discussed today are important to the Council on Aging. They are important to the National Association of Federal Retirees. They are also important to the Canadian Association of Retired Persons. And I can only encourage the participant, and generally speaking, seniors tend to massively go to the voting center and exercise their vote. But on behalf of our three organizations, I want to thank you all for being here today. I want to thank the participants for attending, and I hope you have appreciated this session. And that brings me to formally saying that this session is now adjourned, and I wish you all a great day. Thank you very much. Merci.